Today, we are honored to have Dr. Otis Brawley, the Distinguished Professor of Oncology and Epidemiology at the Johns Hopkins University. Welcome, Otis. How are you?
Hello, thanks for having me.
My pleasure. So let's start out with, you always, of course, went to many meetings, particularly cancer meetings when you were with the American Cancer Society. And these meetings tended to be all in one specialty or kind of siloed. The Vatican conferences are very different. They bring people together from lots of different worlds, if you will. What do you think is the value of that?
You know, I was educated by the Jesuits, and I was taught to always be introspective, to think about what you're doing. Part of thinking about what you're doing is context. And the context of what an individual scientist or physician is working in is defined by what other people are doing. So it's not only fun and interesting, it's really necessary that we know what other people are doing if we're going to be as effective as we possibly can be.
Absolutely. So one of the very important areas these days, in addition to the science of research, particularly in cancer, is the unequal distribution of those benefits, if you will.
Mhm.
Racial and ethnic disparities in health outcomes. How do we work to close that gap?
Well, you know, some of my most recent work shows that in the United States for cancer, more than 20% of the deaths that occur would not occur if all Americans had all things that we currently have. Not new science. The new science is to get the old science to everyone. That includes prevention, screening, diagnosis, and treatment. Prevention is frequently ignored, and everybody focuses on how to try to get treatment to people once they are somehow diagnosed with disease. We need to focus on the entire spectrum and focus on getting all those things to everyone. How can we provide adequate, high-quality care, I think, is the most important question. We need to look at our systems. In a lot of county hospitals that are safety net hospitals, we need to make sure everybody has a physician or has a healthcare provider who's counseling them about good health.
Is it important to have also providers who look like the people they're treating?
I'm going to say no. A lot of people say you have to have Black doctors so that Black patients can feel comfortable. Yeah, we do need more Black doctors. We need more Hispanic doctors, yes. But one does not need to be the same race in order to take care of a patient. One needs to be understanding of that patient and want to take care of that patient, and it'll come through. And the patient will accept that. White people can take care of Black people and vice versa.
How do we make, is it simply access? Is it insurance, payment? How do we try to make some of these new and apparently very effective novel treatments for cancer more accessible to everyone?
It's an access problem. It partially is insurance, but once people have insurance, they need to have navigation to guide them through the medical system to help them to get all of the things that they need in order to have better treatment and better outcomes.
The system is as complex as it ever was, in many ways, even more so.
That's absolutely correct.
We need help to work our way through it.
Yeah. We've instituted some navigation programs with some success. This is usually an individual. They need not be a nurse. They can be just someone who is smart, who knows the system and can help guide the patient through the system and can do it very inexpensively and actually save the system money.
That's the part that people miss often, is that by doing it the right way, we actually save money. It doesn't actually cost us any money.
Absolutely.
Dr. Otis Brawley, thank you so much for your time, your expertise, and your insight. We appreciate it.
Thank you for having me.